My name is Dr. Hildebrand. I'm a chiropractor. I graduated back in 1998 from National College of Chiropractic. I got into chiropractic mostly because my mother needed chiropractic care. I used to carry my brother around. My brother had muscular dystrophy, so he had to get from place to place and she'd carry him. And I've seen pictures of my mother when she was really young, like college age. She was a string bean, but after having him and carrying him around, she got pretty muscular. But because of that, I think that put a lot of stress on her neck. This is the point that we use, master shoulder. That's been shown to release endorphins. We're known for lower back pain, so that's what we're kind of famous for. There's a lot of things on that list that we treat very successfully that people don't know about. Chronic stomach pain has been by far the biggest issue that we've treated this year. My favorite of all time was an ulcerative colitis case. And she was 6 or 8, I can't remember now at this point, it was a while ago. Her face was getting all swollen, so all the kids were teasing her in school. In the intestines there's ulcers, and that bleeds, so you get bloody bowel movements, you get diarrhea as well. And this poor girl was getting 20 of those a day. When she got adjusted, the very next day, all she had was a little bit of cramping, and the blood was gone. And then after that, she only had one little minor symptom, and she never looked back since then. That was by far my favorite case. When you adjust someone's spine, the capacity of treating the body grows exponentially because the brain controls your body, and the conduit, what takes the information from the brain to the rest of your body, goes right through your spinal column. And when that spinal column is kinked or twisted, it can pinch those nerves going to those end organs. And when that happens, a lot of different symptoms can occur. All right, breathe. I use a technique that is, it's called prone specific, and the patient lays flat prone on the table, and I do my manipulations that way. But in the end, if you're moving the bone, you're going to help people, and you're taking the pressure off the nerve, you're going to help people. If I can do it as gently as possible, the patient is relaxed, and the more relaxed the patient is, the more effective it's going to be, and the more comfortable it's going to be for the patient. So that's our goal. In your consultation, just talking to the patient about what their problem is, you're going to get 85% of that diagnosis just from talking to them. And then what you do is you come in, you confirm what you think, or you figure out it's maybe your second or third or fourth possibility based off of the examination. I typically x-ray my new patients, and then I don't have to worry about a hidden bone disease. So there's a lot of information. You can see where they're misaligned. You can feel with your hands where they're misaligned, and oftentimes you can see just by looking. I had a case where there was a failure to thrive baby. The doctors put their hands up in the air and said, "Take him home, there's nothing else we can do." I saw a baby that was completely inside himself. Like he was looking, his eyes were open, but he was looking right through you. And because he was experiencing so much pain, he wasn't interacting with anybody. So I adjusted him 5 times, and it was the same reaction each time until that 5th time. He never looked me in the eye until that 5th adjustment. The 5th adjustment is what did it, and it did it instantly. And I sat him up on my lap, and he just looked at me, and he was not going to move his eyes. He just stared at me, and he had this look on his face like, "Oh, thank you so much." It was amazing.
Thank you.
You're welcome. Thank you. It's the patience. It's the patience what make it fun, and being able to do the healing with your hands. But that's what makes it fun, and seeing these people get better. People can't walk when they come in, and they're able to walk, and some of the stories are just absolutely mind-boggling and crazy.